So what is a patient advocate? As a bladder cancer patient, you have a unique experience of how bladder cancer impacts on daily life, right? So, you know, there's lots of skills that you have inside that maybe you don't realize. Do you wish that more people understood about bladder cancer? Would you like to be more involved in bladder cancer research? Have you heard about a policy or law that you think is unfair? And this is where it's really important to have the patient voice. I mean, you can that is me there, and I'm also with a patient, and we have another lady who's taking part as well, Susan. And these kind of events that you can see here, it's extremely important that the patient gets their voice out, because we've got a different kind of insight into what's going on. We can have a different kind of conversation as well. We can almost laugh at ourselves. If somebody else spoke to us and laughed in the way we laugh with each other, it might seem a bit strange, but we actually know what the treatments are like, and we've got that extra, maybe an extra drive to make a difference. Amy, next slide, please. So, by becoming a patient advocate, you will be able to join a community of ambassadors where you can help fight bladder cancer and improve national and international healthcare activities. Being a patient advocate and speaking up for people with bladder cancer can make a huge difference to how healthcare is delivered in the future. By acting as a representative and getting involved in a range of ways, patient advocates can help change the way a condition is managed. And you can see Anita and her husband Tim there, standing in front of the Winnaker Tower. That's a really lovely photo. It was quite a mad year that year when we was raising awareness, everybody. Next slide. A patient advocate. So a patient advocate is a trained patient who contributes to one or more of the following activities. So there might be areas that you know that you're already good at, or that you have had experience in, and of course we would like to hear about that, and you can get involved in that, and we will help you as well if you need. But there might be areas that you've always fancied having a go at, but not really known how to go about it, or whether you've got the confidence. So this is what this is all about, making sure that you have that. So you could maybe join meetings with, for example, the World Bladder Cancer Coalition, the European Cancer Patient Coalition, the British Bladder Cancer Expert Working Group. Give public presentations about various topics, for example, your bladder cancer journey, Fight Bladder Cancer information, well-being with cancer. I mean, really, they're almost all they're all included in one, aren't they, those things? And you can do these at events like in hospital awareness days, support groups, pharmaceutical team events, British Association of Urological Nurses Conference, that's BAUN. Giving advice to research organisations on their research priorities. For example, National Cancer Research Institute, the British Bladder Cancer Research Consortium, and the Urology Foundation and Cancer Research UK. Some of those things might actually initially sound a little bit scary, but the titles make them sound a little bit more worrying than they actually are. Next slide. Okay, some of the things are scary. Maybe talking to pharmaceutical companies and universities to ensure that clinical trials take on board the views of bladder cancer patients. This could also involve taking part in a trial. There was a couple of people that already have started this and gone through the program already, and they've been involved in discussions with a brand new trial, which is quite unusual. So that's where we're quite handy at the very early stages, getting the information right, making sure everything's right for the patient. Reviewing a charity's organisational strategy and projects. Review guidelines and contribute to consultations with organisations, including Public Health England, NICE, SMC, NHS, European Association of Urology. We get asked quite a lot to check things and to have our opinion. And the last thing, a patient came along and we talked about a demographic, and we went through the whole thing and had so many changes and ideas, and they're really, really pleased to get our opinion on these kinds of things.